Hello everybody, I just wanted to make a video about risk assessing. Now, risk assessing is something you use if you think someone is suicidal or you're truly concerned about somebody. Maybe they've been depressed for a long time or they've gone through a lot of stress and they just feel down. So you would use risk assessment for this to see if they are in risk of suicide and they need help. So there are 4 steps of a risk assessment. The first step is ideation. So you basically ask them, are they thinking about suicide? Do you have any suicidal thoughts? Do you have thoughts of killing yourself? Stuff like that. Then after they answer that, if they say yes, you would move on to the second step. The second step is plan. So do they have a plan for how they would go through with suicide? So you basically just ask them that. Do you have a plan on how you would kill yourself? Essentially, let's say they would use a knife or overdose on pills, stuff like that. Then you would go on to the third step, which is means. So it's essentially, do they have access to what they would need to act on their plan? So you'd ask them, if they said overdose, you'd ask them, do you have the pills necessary for you to go through with this? Or if they have a knife or a gun, do you have access to that? If they say yes to that, you move on to the final step, which is time frame. So you would ask them, do you plan on killing yourself within the next 24 hours? If they don't, if they say maybe like, oh, I've been thinking about it maybe in like a week or something, then they don't pass this step. And that you would do is you would talk to them and listen to them and just try to help them as much as possible. You would ask them to stay away or put away the thing that they would like to use to act on that suicide attempt. So if they have pills, ask them to put away the pills or stay away from them, something like that. You would also find someone to go out and reach out and to get help. So like a therapist, a counselor, maybe a teacher or a professor or someone you know that's certified in mental health, like first aid. So you would go to those people and they can help you out and they can help them out and get them the resources that they need. But if you don't have any access to that, there's plenty of great resources online. For example, there's 211, there's crisis text line, there's the National Suicide Prevention Hotline. There's also the American Foundation for Suicide Prevention. All of those are great resources that you can go to get the person help. Now, if they did plan on committing suicide or killing themselves within the next 24 hours, then you would go straight to finding them help. Like the counselors, like the therapists, stuff like that. You would go and find help for them because this is an immediate risk. This is when a mandated reporter should report for the 911 to get help because they're in serious need. So that's all I wanted to say about risk assessment. So the 4 plans are ideation, plan, means, and time frame.